is it possible that as microbe number and spread is more abundant in microscopic pyuria, that simply reducing excessive numbers of microbes may be a mechanism to reduce pyuria? And if so, does it make sense for patients to take nitrofurantoin, for example, post-coitally, if this is their only trigger for cystitis symptoms?
Well, the answer to that is probably not, but not 100% sure. What we found when we were doing the work with Maria Dioria and others is that the higher the white cell count, the greater the chance of a positive culture. Now, everyone will jump on that and see, yeah, there you are. So plethora, plenty of bacteria, high counts means that they're the cause of the infection, means it's infection. Well, I dispute that, because the greater your infection, the more you'll be shedding epithelial cells, the more you'll be shedding white cells, and we see it. You start accumulating this amazing deposit at the base of the bladder of dead cells, lyse cells, dead bacteria, sugars, fats, protein, the lot. And bugs will feed on that. And we got saprophytic bugs living in our bladders that are there to clean up. And these saprophytic bugs are there eating it all up, cleaning it up for us. And the more deposit you have, the more that you will get a positive culture. And I really started suspecting this many years ago when we were using catheter specimens of urine. And I noticed that if at the end of the drainage, we got this sort of yellow muck coming out down the catheter, then the probability of a positive culture was extremely high. But it was only when we started to do this comparative molecular analysis of the microbiome that I realized that they weren't necessarily pathogens. And then of course the panic, then we were forced back, and of course the idea that these are basically harmless composting microbes is probably relevant. So the trouble is that I think at this stage we just ignore the culture data. We ignore it 100% because it's just so misleading.
Thank you.
We do the cultures in order to survey for resistance, but in fact we're going to transfer our resistance surveillance to molecular techniques in 2 weeks' time.